Hey, it's Rebecca Seagraves, and I am here with Dr. Marcia, and she is the owner founder of Move with Marcia and physical therapist. And we have a really exciting topic tonight about pelvic health and whether cash pay pelvic health is actually hurting or helping the overall profession, the access to services. Dr. Marcia, what really got you interested in exploring this topic yourself? What led you on the path to really asking the question if we are doing people the service that they need by making it that much more of a barrier if we are cash pay providers. What got you thinking about this?
Well, sure. It's definitely a general discussion that has been had, but that's usually when it comes to sports, orthopedic specific. And I feel like as of recently, I don't know whether it's the pandemic and a couple of pivots that folks are doing, or some people went viral. I don't know what it is, but in terms of online visibility, pelvic health is like up there now. So, we've got tons of people that are popular and engaging and online, and on my own personal journey with my own chronic illnesses, I've been starting to have pelvic issues. So seeing all of that in my face, I'm like, oh, cool. Pelvic PT is a thing now. I mean, as far as my program goes, I graduated in 2014. It wasn't really discussed. It was like, oh, it's a specialty thing. This is a women's health. Here's 3 slides. So personally, I don't know much. It's not like oh, I have a frozen shoulder. Oh, I have knee tendonitis. I can figure this out. Not quite. I said, all right, cool. Pelvic PT is a thing. Let me find one. Unless there's no one that takes my insurance, and there's nobody that I can afford. And I don't live in the middle of nowhere. I live in a metropolitan area. There's at least 2 or 3 research hospitals near me, maybe a dozen hospital systems, tons of little clinics. But yet, personally, I cannot find somewhere to walk into. So if I can't find somebody, then what's going on for people with areas that have even less access to healthcare systems than here?
You are right. I mean, as someone who's advocating a lot on the maternal health side, right? We talk all the time about these maternity care deserts. And there are
Yeah,
areas around the nation where you have to travel sometimes, I mean, for hours before you even find an OBGYN, let alone a pelvic health therapist. So I can absolutely understand your point there. I graduated a year after you in 2015. We had a little bit more than 3 slides, but we still did not
just a little
have a
bit.
great plethora of pelvic PTs. And once I got into the field as a pelvic health therapist, I realized, wow, access to our services is really limited. There's not a lot of us. On the flip side, though, you're right about all the ortho PTs. I mean, you could find services on exercise programs, on this, on that, and they're marketing, to a wide demographic. Some of them
Right.
are paid programs, right? And so now we're seeing even more in the pelvic health world being a lot of paid for services, paid programs, things like that. However, there's so little of us compared to how many ortho PTs you could find. You could find an ortho PT that accepts your insurance. You could find someone that you pay a little bit more if you want that, one-on-one care. With the pelvic
Right.
world, because we have so little, the ones that are accepting insurance, it seems like, oh my gosh, where are you? And you're experiencing that now, is that right?
Correct. And there's a very interesting response when it's something that you talk about. Because I might say to someone like, well, dang, like who are we leaving behind? And they say, well, I mean, it's all about perceived value. I mean, if they could pay a personal trainer this, then they could pay me. Like, okay, that's cool. What does that have to do with me? How does that apply to me in my life? I'm not telling you that I have all of these extra discretionary funds. I'm telling you that I am broke and I need services. So when I get that response back, it's like, where's this disconnect? I don't understand, because we're supposed to be in this job because we care. It's patient care, it's health care. Like if you don't care, you don't have to be in a patient facing position. You could go work in tech and make tons of money. But now that you're here, in this health supposed to care setting, and someone says, wow, there's so many people that we're leaving behind, why wouldn't the response be, wow, what can we do to help them? How can we fill this gap? And that's really the part that like gets me, because it's the lack of care, because nobody's going to help us but us, right? Nobody's going to get ourselves and get pelvic PT out there but us. So if we're not approaching it from a place of care and compassion, then we're just chasing capitalism and chasing money, just like any other job. What was, where's the difference?
Well, let me ask you this.
Yeah,
What do you think about the argument from, those pelvic PTs who feel like actually able to help more people because I have more time now. I have more
right.
time to say offer a sliding scale or offer this, service or do this. Whereas say someone like me, I was in an insurance-based model. And
Yep.
even as a pelvic health therapist, it was strongly recommended I get my 1 hour visits, which in our world is very difficult to get a 1 hour visit down to 30 minutes, right? And
Right.
so we find that in pelvic health is very easy to be compared to our ortho counterparts who can do 30-minute visits. But when you have somebody who
Mm,
say, has heavy bleeding or pelvic pain or pain with these really intimate activities, and you're asking them to tell me your whole story and let me do a pelvic exam in 30 minutes, and
yeah.
then still provide that high quality care, we were finding either we were going to get burnt out and even short, lessen the pool of therapists that could provide this care, or we were just going to have to just, be okay with providing low quality care. So, what is your response to someone who says, "I actually feel like because I charge and because people pay, they're paying attention"? What's your initial thoughts to that argument?
I mean, my initial thought is that there are a lot of things that we say and we hear it repeated, but where does it come from and what is the point of that statement? Oh, people are paying for it, so they value it more. Okay, so people have to have buy-in to whatever. And okay, is this like an economics thing, or are we more just buying into like capitalism and spend money? Like, where's that idea coming from? In general, nothing is black and white. Okay, cool. I could practice to the top of my license in cash pay. I can take my time. I can do what I need to do in a session. Cool. But if I'm saying to you, what about the people you leave behind? Then the answer should be, what can I do for those people? You're right. But instead, it's like, no, I can't do insurance because this. Okay, that's cool. But do you have sliding scales? Do you have tiered pricing? Do you even list your prices? Or does somebody have to pick up the phone and chase you down and ask what your prices are? There's even ways where you could say, you know what? I don't want to change my prices, but my prices are on the website. But once a day at the end of every month, I do free sessions, right? There's some sort of intention. It's the fact that there's no intention for financial accessibility. It's just, oh well, I could practice, I'm too restricted by insurance, and well, if people pay, then they're gonna buy into it. That's not enough.
In terms of even getting information about your diagnosis, have you found that again that accessibility is really at the pelvic PT problem, or are you finding in other aspects of healthcare that we're only an extension of a bigger problem elsewhere? Where have you found that information just in general has been hard to come by for even what you've been experiencing?
Yeah, so generally speaking, the whole thing is trash, right? Like, throw the whole healthcare system away. Throw it all away. Start over, burn it to the ground, rebuild.
Mhm.
But the difference is that if it takes me, and it has, if it takes me multiple tries to get a specialist, I could keep trying and I won't go broke because of it, because I happen to have pretty good insurance. It's cool, it's covered, I pay my copay, right? So I have seen, for example, I have been to 7 different neurologists. That's how many tries it took me to get someone that wasn't a jerk. Take to talk to someone that actually believed me, that took their time and spoke to me. So on the flip side, I can't find the pelvic PT, right? So let's hope I find it. And the one and only one that I find it takes my insurance is a good one. Or if it's a cash PT, well, now I have to come out of my pocket. Oh man, I hope this works out. And you can be the best therapist. You can have the best, you know, manner, approach, and you just don't vibe with someone, right? So it's not necessarily like a personal jab. I'm not saying like it always has to be that level of toxicity and like conflict. It could just be like, this doesn't really work out.
Mhm.
But at the end of the day, I would have to come out of my pocket to find that out.
That's true. So you're saying that in the neurology example, even though you had 7 tries, that's like,
Yes,
I mean, we could spend a whole time talking about that, but 7 tries just to find a neurologist. But had you encountered the same situation in the pelvic health world, you would rather not come out of pocket each of those times
exactly.
versus in the pelvic health world, you're encountering that you live in a fairly large metropolitan area, still can't find a pelvic health PT, but you're not willing to come out of pocket each time to find the right one. You'd rather have your insurance cover
Right.
you
If I had the choice.
if you
Right.
have the choice, right? And as far as specifically with pelvic health issues, a topic that's been coming up quite a bit, at least on this platform with me, have been
Right.
that women of color tend to have to, wait significantly longer for a diagnosis when they're dealing with a pelvic health issue than their white counterparts. We have the highest morbidity rates, the condition of having to deal with an impairment a lot longer than a white counterpart. And so my question to you is, given that situation where people are already waiting longer with an insurance-based model, do you still feel that these cash-based services are making it harder, or can you see in some way that they might actually be alleviating some of that waiting that people are having to face?
I would say it's alleviating, but how does that person find you? Right. So, for example, personally, I have seen many OBGYNs for all of my issues. Not one has ever mentioned seeing a pelvic PT. Not one. So if I'm somebody just off of the street, how do I find you? So if we're talking about like just that level, not really. But if we're somebody that know, okay, I know I need a pelvic PT, I'm not getting the referral I need, or I'm not. This person has a wait list, and I could afford the cash PT that I found, then sure, it's bridging that gap. But what happens when they can't afford it, and that PT has no intention to create any form of access besides this is my price and that's it.
But let me ask you this. Do you think that if you were to approach, pelvic PTs, even one-on-one,
Mm-hmm.
um, that that kind of bartering, right? That we're discussing, and I call it barter because in a way you are trying to convince someone, can you offer a sliding scale? Can you do this? Can you do that? Do you feel like that would be an unfair way of being able to just at least get the care that you need? Or do you feel like, that might be, something that opens the door and that kind of makes care more accessible?
Right. So if I, as the patient, was the one bringing up the
Yes.
issue,
Right. Bringing up the issue, contacting, yes, getting
right.
on the phone. I understand that how inconvenient just hearing you say that is. Like, yes, you have to chase down people to find out what their price is. The only thing I can think of, that's like that is really a non-healthcare care model, call for pricing. You know,
Yes.
you
Yes. It's not
see that
healthcare.
you see that in the commercial there, world that that's not healthcare. But I find that yes, a lot of the healthcare providers who are using that, those advertising, they're really trying to get people, at least I'm kind of defending this, right? But they're
Mm-hmm.
trying to get people to, in a way, take ownership or investment in their care.
Mm-hmm.
You find that you would be willing to barter for either a lower price or a sliding scale to get the care that you need.
Oh no, absolutely not.
Did you feel like
Because
it's fair?
that
Or
it is to put the burden of the labor on the person that is having the access issue to bring up the issue to you and ask if you will address it.
Mhm.
Absolutely not. No, thank you.
You feel like that is not right to put the burden on the person who's dealing with the issue to say, if you do want these services,
Mm-hmm.
you're going to have to find a way to bargain for them.
Yeah, I don't think that's right at all. To me, is I understand call for pricing if you're a graphic designer and your scope of work varies, right? You have to discuss, okay, how many logos, what are the colors, what are the deliverables, like, or other fields. But we're talking about a fee, even if you're outside of the insurance-based model, it's still a fee for service-based model. It's still how many hours that you don't just treat a random amount of hours as a cash PT, right? So it's not that you don't have a price. Not listing it on your website is already a barrier. But let's say you list it and you don't say anything about, hey, if you are a person of color, if you are of a marginalized identity, please let me know and we could figure out how. If you have nothing like that on your website, if there's nothing that talks about these things, then I'm not even going to feel safe to bring that up with you, because we also have to consider that you are not the only provider this person's ever seen, and that people have experienced, I have experienced medical trauma. So I'm not going to put myself in a position where I don't feel safe. So saying that that person, oh, well, it's just a phone call, they could just call. No, because I'm going to think about, well, remember that other time I called and this guy said this and this happened. No. Or on the flip side, it could just be somebody that has so much going on that you saying just make a phone call. Well, maybe they work night shifts and when they get home they have to get their grandma ready to get picked up for adult daycare, and then they got to pick their kids up, and then they have to do this. But just make a phone call was actually a big barrier to them, versus they could see right now if they can afford you or not. And there are other people that say, well, you need to sell your value. You're not a car salesman. Like, nobody should have to pick up a phone and speak to you. And if that is the method of communication that works for someone, they will call you regardless, right? So that really shouldn't be the plot point, is, oh, well, you have to sell your value. What's your website doing? Why do you have a website at all then, if I don't understand your services and your value?
So let me get this right. You would respect a
Yeah,
pelvic therapist more if they, just listed their pricing first of all on their website. That would be
correct.
more respectable, acceptable to you if they at least were transparent about their pricing.
Correct.
Is that right? But because they're not, and you're having to pick up the phone and you're having to kind of go through this bartering system, or, this conversation of being sold on, you feel like that's even more disgraceful. That almost is a trigger for medical trauma that you've had in the past.
Precisely.
Got it. There's a question that came up, and it's from Dr. Shiroz. Thank you, Dr. Shiroz.
So with that question, right, when you're saying why would you not have the prices on the website and things like that? Because it could be a barrier in the sense that someone could see that price and there's like out of their minds, it's not even something that they might be able to afford. Versus, okay, well, it's not there, so maybe I do need to send a message. Okay, most people have the spot where they can send an email, or maybe I do need to call, or they'll call me at a time that might be appropriate if we discuss that. So that you can have that conversation and say, well, I understand this may not be may not be something that you can afford, or you think you might not be able to afford, but how can we work with you to be able to afford it? Right. So if it's the amount of visits, can we spread them out over a longer period of time so it's more appropriate? If I know you said something about having a sliding scale, sometimes it can get tricky because how do we decide who is appropriate? How do we say, oh no, you are underserved or underprivileged enough
Mm-hmm.
that I'm going to give you a sliding scale, but someone else, you make just $1 too much and it's not appropriate. That's where the question comes from. Having that room to be able to say, okay, what are your concerns and how can we make this more affordable for you in a way that, the business is still going to be able to run. I'm going to be able to offer these services to more people, but also I can get you in the door and give you the service that you deserve.
So number one, surprisingly, people do not have email options. So I've been through a lot of people that don't. It is only call for pricing. That is it. No email options, no back and forth. If you send a message, they're just going to call you back during business hours. And if you're working during business hours, you were planning to receive a phone call, it just doesn't really work out. So I would say that is a good point, is making sure you have multiple forms of being contacted, but like, email. Some people have text, that's not for everyone, cool, but something besides just a phone call. I think that's a great point. So if you don't want to put the price, or you're scared of scaring someone away for the price. Why can't you just put the things that you told me on that same page? This is what I mean by transparency, is letting people know where you stand on everything from the jump. So right there on that page, and then, just say, hey, if price is a barrier, please contact me. We can figure this out. Put it right there on the page so they don't have to wonder. Because again, if somebody has been through medical trauma and they get to the point of having to wonder whether a conversation can happen, it won't happen. In terms of the sliding scale question, so the way that works, the difference between sliding scale and tiered pricing is sliding scale. If I come to you and I say, well, I need PT, and you say, okay, it's an hour, the price is $150 to $250. That's all you're going to say. So that's sliding scale. And then I would choose the amount that I could pay. So people do get a little wary about that, but trust me, people will pay what they can afford to pay. People aren't going to like shaft you, right? But you also have to be mindful of that, especially as Black and brown women. We're already getting paid less, right? We're already dealing with a lot of other inequities outside of that moment. So that does get a little tricky. The difference between sliding scale and tiered pricing is that you're putting it out there. So whether you have numbers and you say, well, 150 is my community rate, 200 is my whatever standard rate, 250 is my sustainer rate. If you have more money, please give 250 so you can help the people that can't afford it. And the people that can will give. They really will. It sounds like it wouldn't happen. But again, we're in a position where we're supposed to be about community and caring. So like it will go that way. So that's a difference. You can also do tier pricing in terms of some people choose to just name who they want to help. If you are a Black femme, this is your price. If you want to say that for your practice, you can. Nobody's going to stop you. It's your practice. Do your thing. So you can name that. If you are, queer identity, trans, whatever, this is your price. You can say that as well if you'd like, because we know there are, more likely to have financial inequities when we're talking about marginalized identities. So if that's the way you want to do a tiered pricing, you can as well.
And so what I'm hearing, Dr. Arian, if you have anything else to add to this point, but what I'm hearing the most frustration, about cash pay, pelvic PT is the transparency. Am I correct on that? Is the transparency. I definitely believe, thank you, Dr. Arian. I definitely believe that there is room to absolutely improve on that with everything that you said. I really love the sliding scale, the tiered pricing, options that you gave. That was excellent. I want to focus on women of color and marginalized groups. I think that there's already enough of a barrier in terms of like getting the healthcare they need, definitely with pelvic health issues as well. But you're right. It's unfair to, for us also to assume, well, they won't pay if we do just offer cash pay services. It's the transparency that's needed. But for that, group of people who, okay, they really just cannot afford services, what do you think we should be doing more of as providers to really make sure that they're just not falling through the cracks? Like when we can do something about it. What do you think that, more needs to happen there in terms of the pelvic health providers? Should we take on the responsibility
It's
of, bringing our prices down to zero if that's the case, or accepting insurance? What do you think?
I mean, if you don't want to do insurance, then you don't do insurance. But there definitely has to be some sort of intention made to, okay, there's going to be people I'm missing. What can I do for them? And how that looks for you and your business, it depends, because obviously you need to get your bills paid. And more than likely, the people worried about us are going to be us. So if we're being honest, so we already know that we're all kind of in the same boat, dealing with kind of the same issues, right? So just kind of bringing attention to all of those things and then saying, okay, what makes sense for me and my business? So, okay, tiered pricing, maybe not. Sliding scale, definitely not. I need to know exactly how much I'm making. Maybe tiered pricing is cool. I'm not sure, right? Or, maybe I just explore, like Dr. Ariana said, maybe I explore, we could space out sessions or just putting something like, I can work with you, right? At least that's an intention. That's an idea. That is me on your website seeing it and being like, oh, okay, maybe this person won't make me feel like all I have to do is skip a latte, and be able to afford them, right? And if I'm a person that wants to call you, I wouldn't have read it anyway, and I would have called you. So you're getting both people there. So the biggest thing to me when it comes to taking up that responsibility is just understanding that, there's like no morality to somebody not being able to afford your services. I think there's a lot of times where healthism kind of creeps in. So healthism is the idea that it is the individual's responsibility to take care of themselves, and kind of like the same idea as people who were like, oh, so and so had issues because of COVID. Oh, is it because they were fat? Or, oh, is it because they had heart issues already? Like, it's the idea that nothing can happen to you, without your consent. Like, you can control whether or not you'll ever be disabled or chronically ill, which is not true. So it puts a lot of onus on the individual. You have to be eating right. You have to be budgeting. You have to be doing this and that. That's not really the way health goes. It's community. It's all about the community care. So that does kind of creep in because people get into that notion of, well, if they needed this help, then they'd get it. So I think bringing attention to that and making sure you're not in that headspace would be great, because some people that I've talked to was like, wow, please think about this. Where are these thoughts coming from, and what are we thinking about these people that can't afford us?
Having come from a family who celebrates probably with a little bit too much to drink, or a little bit too much of other substances. And I'm just like, we do this to ourselves. And I can't, imagine that every provider, is free and clear of that. I think that we all have our own biases that we bring
Yeah.
in practice that really do end up hurting the people that we're trying to serve. And
Yeah.
so, with healthism, I can say that I've focused a lot more on people who are willing to invest, because for my mental health sake, it was very hard seeing insurance companies, collectively gross over $30 billion while hospitals were shutting down. That was really hard.
Yeah.
So you're kind of, making me, you're stretching me a little bit, because I went to one extreme where I said, no, I'm out of that insurance game. I know where that leads. I was willing to provide free services, then try to be in the insurance factory mill of what healthcare was. But you're bringing some points that, yes, I can see, this could be actually more detrimental. Dr. Middlebrooks is putting in the chat that healthcare is a community, but also individual, and should be individualized more often than what the
Of
current
course.
allows. And I definitely agree. And well, where does the individual responsibility lie
Mm-hmm.
on the person to say, if I really want this, problem resolved, I'm willing to go a little bit above and beyond just what my insurance would be willing to reimburse this provider. I want to actually show this provider I value their time, so I'm willing to pay out of pocket. Do you feel like there's any room for that argument?
Oh, definitely. That makes sense. Somebody can afford it. So I'll tell you my personal story. I have literally a dozen specialists. They are all covered by my insurance. But if I go to see that specialist, that's $34 for the copay. It's about 25 miles, so that's maybe $3 in toll. The parking isn't free, so that's $50. I'm probably seeing one of those specialists once a month. Let's say they order follow-up blood work. Let's say I have to do some scans, like I have an MRI coming up. So that's also time I have to either figure out how to not, get dig into patient care so I can still make some money, right? So that already is a standing cost for me. It's a monthly cost. So what is that? We'll call that $100 a month visits. Then there's things that I have to do to take care of myself that insurance doesn't cover. I have to buy over-the-counter eye moisturizers, over-the-counter nose moisturizers. I have to get over-the-counter vitamins for my deficiencies that are not fixed with food. I eat tons of vegetables that are not fixed with food out of pocket because my insurance doesn't cover over-the-counter. So that's another added cost, right? So we didn't even get to my rent. We didn't even get to my groceries. We didn't even get to gas or my car payment or my student loan bills. But I already have a couple $100s I'm spending extra month. So it's not necessarily for everyone. I don't think it's fair to assume of everyone, well, if they wanted to afford us, they'd find a way.
Mhm.
Because there are providers I already pay cash for. because of having issues. So, for example, I pay cash for my PCP because I couldn't find a good PCP. So every time I need to see her, that's $300 for the visit and the follow up.
Right.
So it's like if you're without asking me questions, if you're asking the question, you know, at what point would you be able to afford and whatever, cool. But if you just come off the assumption, well, if somebody wanted to afford me, they would, you don't know what's going on in anybody's life.
That's true.
You have no idea. So that's me. And I am lucky that I'm married to somebody that has government insurance. If
Mhm.
it wasn't for that, things would be a lot rougher.
I totally understand. Dr. Middlebrooks is asking to chime in. Dr. Middlebrooks, you're on.
First and foremost, thank you for your time, but also let me, I can't apologize for how the healthcare system has treated you, but I can at least apologize and empathize with the situations you've been put in, especially as being a Black woman and knowing that there are those healthcare disparities that are present. Um, there are several things I actually want to say, and I am cash based. I have gone cash based simply because for several reasons. The biggest reason, I got tired of insurance. Insurance in our country is a necessary evil. With that being said, I don't think that cash based is the evil part. I think that there are a lot of people who have moved to it either, like you said, for the capitalistic mindset, but you also have a good number of people like myself who are like, no, I can actually spend the time that I need with my patients and I can give them the care that they need. And on top of that, I'm able to make myself more available so that way, if they do need to call me, if they do need to message me, I'm able to give them that additional support that I could not do when I was seeing 20 people in a day. So I do believe that there is a place for it. Unfortunately, we do live in a capitalistic nation. There's some good things that come from that. There's some bad things that come from that. So some people are trying to more so optimize as to how much they can make versus how many people they can help. And there's two different mindsets. I would hope that most healthcare providers would have the mindset as to how many people can I help, but I know that's not the case, and that's not the case as well for people who are also in the insurance model. Let me speak to insurance a bit briefly as well. Insurance is actually the biggest issue. As was already mentioned, insurance is they're making billions and they're finding ways to cut reimbursements while people's premiums and deductibles are still going up. So because of that, a lot of people have said, you know what, I have to afford to live as well. And I have to be able to still maintain my sanity and also get my patients the care they need. So they are beginning to cut ties with certain insurances, in some cases, all insurances. It is unfortunate because you do have a large demographic of people who they don't have the money to put into health savings accounts. They don't have the additional money to kind of just throw out to say, yes, I can get this care. And there are times as well, I'm going to go to that next, but there are times where budgeting can help, but there are also those situations where it can't. And people are on a fixed income and they cannot afford it. And with situations like that, in my particular practice, what I can do to address that is I can do community courses. I can do community workshops. I can offer those different events. And the reason why I can do that now is because, like I said, I'm not seeing 20 people a day. So I'm not stretched to my max. I'm actually stretched to a point where this is comfortable. I can still provide the care that my family needs, still provide the care that my patients need. But now, because I do have the additional time and also the income to do so, I can also offer free services, reduced services, community classes, group events, so that way people can still get the education, at least know what resources are available. So I think it's all about how you approach it. And quite in all honesty, I don't put my prices online because I at least want to have a conversation with people. When people call, I let them know if I'm not the provider for you, I'll send you elsewhere because my goal is for you to get the treatment that you need, regardless of who you see. And that itself is very important to me because I do pride myself on my integrity. Because at the end of the day, I'm doing a service for you and I want to make sure you get better. And even when people, and I had people before say, you know what, I cannot afford, and it's like, okay, well, let me see what are we able to do. If I can't do anything on my end, you know, what type of insurance do you have? I can contact this person. I know they have a wait list. Let me see if there's anything else I can work out to try to get you in sooner. Sometimes I can, sometimes I can't. So I at least want people to know on my end, with me being a cash-based provider, I'm not in it for the money. I'm in it for the patient care. And if I'm not your option, then someone else, or we can help find someone else who is. And even then, when I do see people on the first visit, I let them know as well, my goal is not for you to waste your time nor money. So after this visit, if you don't think I'm providing a service that's worthwhile to you, don't waste your time or money with me, point blank. because that's what people need to realize is that even if they're cash based, if they're insurance based, that they are a customer and they have a right to choose who they go to and when they go to them and how they see them as well. Now, I do hope they value my input and my opinion with their care, but ultimately they have the right to choose. And because people do have the right to choose and they are individuals, I'm not going to lie either. It's extremely frustrating when I have patients and I'm like, you know what, you really do need to make this dietary change. Your blood sugars are horrible. You really do need to do this. And that individualized care itself, um, it gets missed because people are just thrown medications when they're, especially in certain models, they're just throwing medications. They're not seen as being an individual. And why aren't you able to get your insurance, your insulin under control? Why aren't you able to get your sugar under control? Is it because of financial hardship? There's something else that's going on. So now I have the time to dive in a little bit deeper to get those answers and potentially offer like solutions and resources. When before I went cash based, it was like, okay, your blood sugar shouldn't be 500. This is what you need to do to get it down. Next thing. And I always felt brushed. So it's disheartening for me to hear that your stand on cash based providers, because that's not why I'm in it. And I would hope that as more, especially more women of color become involved with cash based, that people will begin to see that our heart is actually in this and that we are really trying to make a difference in the community, even if I'm not putting my prices up there, because my prices aren't up there because I want to have that conversation with you. I at least want to be able to invite you out to an event that I'm doing if I can't personally treat you, because I can't treat everyone. And I get that. But I at least want to make sure that at the end of our conversation, you still feel empowered and that you also still feel like you have resources that you can lean on.
Thank, thank you for sharing that. So I don't have a black and white, nothing in, we're obsessed with binaries in this society. Nothing's black and white. I don't have a yes, no towards cash PT. I definitely have a full body no towards people that are just money, money, money. But everything that you're saying is what I'm feeling like is missing. So the more of you that could be out there, cool. You don't want to put your price on your website? That's fine. We talk about that for like ages. Who cares? The rest of it, like the rest of it isn't even what people aren't even touching the rest of it.
They're not. I want I do.
Yeah.
Can you be my no, seriously. I want that level of care, because who even says, oh, I'll be at a community event? Dr. Marcia, you just said this at the beginning of the talk, like you can't even find a pelvic PT because they're not, in the community where you could find them. And Dr. Middlebrooks, I mean, she was giving us that whole like, scenario of where she's present with people, she'll find an alternative. She'll be at a community event. She'll give a course where a lot of people can attend. That's what's missing in our healthcare. I mean, that's where we are. Like, we don't even have ways to find people that we can afford, or at least, have our question answered in a group forum, because, the transparency is just not there on all fronts, not just about their prices, but just where are you? Do you care about me? Other than just making room for the people who can afford you and afford that one-on-one. You're not showing your value when you're behind closed doors.
Right. And if we're talking about, being able to practice to the top of your license and doing the things and the freedom, what Dr. Middlebrooks is saying is like, those are the things that we should be like, great, I get to do this, not just I'm charging as much as I can, one-on-one, that's it, full force ahead. Like, those are the things. So now I can sit down with somebody and talk about their full list of medications. Now I can sit down with somebody and I have a referral network ready to go, right? There are people that I've asked that as well. Hey, I can't afford you. Anybody else? Crickets. And to me, it's that lack of intention for the community aspect, like the caring and the compassion. Like, great, we're in that room for 1 hour, but what are we doing outside of that to support people? Because that's, we're not just a physical therapist inside that room, we're physical therapists all day long. Like, how else are we showing up in our communities? So I love everything that she shared. I wish there was more of that.
Yeah, and we're going to bring this talk full circle now with, kind of just ending on that community aspect that Dr. Middlebrooks described, that she does for her practice. Is, we didn't even talk about our story and how we came across, but you went right to the community. I mean, you put it right out on Twitter, and I just said, oh my gosh, I think someone tagged me, that's in the Twitter world. And, you know, since you've put that out, I have been tapping into several networks that I'm a part of, and this search is not going to end. I will work until I find you personally, find you a pelvic PT that jives with you. And, you know, part of what my company does is we fill in the gap for people. You know, we're taking donations or we're taking revenues from programs or webinars or anything that I'm selling as an affiliate, you know, getting pelvic health, you know, just at least understood earlier. I don't want, you know, girls at the age of 11 in extreme pain because of their menstrual cycle and they don't know what's going on with their body. You know, we have to break this cycle. So a lot of what I do is I fill in the gaps of this, you know, as a thank you to you was, you know, please come tell your story, share your stance, and help us figure this out. You know, we need that community. We need open dialogue like this. And you know, with you being able to share, you know, what you shared tonight, I'm able to get it out to more people and tap into even more networks so we could find you someone, you know, where you are. So thank you know, you know, for sharing.
Yeah, definitely. I'm happy to be here. And just for anyone that's wondering, like I literally just went on Twitter and said, I need a pelvic PT. I'm struggling here. And the time that you got tagged was my second time trying that. The first time I tried that, a white man replied and said that, what do you want people to do? And just went on a rant just to tell you the kind of feedback that I get
Yeah.
when discussing this kind of topic.
Well, you know what? And that took a lot of courage for you to put it right back out there. So thank you. Thank you again. And, you know, you got me thinking. I mean, you know, for Dr. Sharoz to have, you know, joined on and Dr. Middlebrooks, be honest with you, you definitely, you have opened up my stance a little bit on this. There's a lot more that we can do in terms of transparency, in terms of showing our value, and just in terms of just reaching more people. So I appreciate your time.